Good afternoon again, everybody. This is Dr. Christopher Scheno from the Keratoconus Center of Long Island. I'm putting out this video today because it's a topic that is seldom covered ever by anyone, but a really important one, certainly to the patient, and that is how to get your keratoconus care paid for. There's various methods that our office and other offices offer, such as payment plans, care credit, which is a situation that you would apply for a line of credit that you would pay back in a certain period of time. And if you did pay it back in a certain period of time, there would be no interest on that loan, and you would just pay it back, which helps out a lot of people. But the question comes up a lot of times, does my medical or vision insurance cover my lenses and the services related to my keratoconus care? And oftentimes the answer is no, given by a lot of practitioners. But the truth is that given the right circumstances and given the right coverage benefit level, many patients can use either their vision insurance or their medical insurance, depending on the scenario and situation. And it very well may actually cover either all or part of their lenses and follow-up care for keratoconus. A lot of it depends on the coding, how you code the claims. You also have to know the procedures that each vision or medical insurance uses to procure the payment, and it varies from carrier to carrier. But if you're aware of those things, you definitely can get your services covered, usually by the vision insurance, certainly, and by the medical insurance in certain circumstances. Even Medicare, through something called durable medical equipment, which is a subsidiary and offshoot of the actual Medicare, can cover your keratoconus lenses and services in certain circumstances. So insurance can and often is used. I mean, in our office, speaking for ourselves, we always try to make the best use of insurance benefits, be them vision or medical, and oftentimes are quite successful in getting these services covered for our patients. Again, it is really, the devil is in the details. You really have to know how to code. You have to know, as the doctor, how to put the claims in. And if you know how to do it correctly, a lot of times we can get it paid. Some of the vision insurances that have what's called a medically necessary contact lens benefit, which is really a huge part of getting this covered, plans like VSP, Vision Service Plan, plans like IMED, a plan called Spectera or United Healthcare Vision. Another plan, Davis Vision, has medically necessary contact lens benefits that usually pay in full for not only the fitting and materials, the lenses, but also for follow-up care, which is a huge financial relief for patients, especially given the fact that they have to do this sometimes every year. The great thing about the medically necessary contact lens benefit that a lot of these plans offer and that we work with is that since it's a recurring expense, you have to do it every year, the medically necessary contact lens plan is given to you once a year. So just about when the lenses need to be replaced, a lot of times the new benefit kicks in and it covers them again. So even some plans, if you have a change in less than a year, sometimes they'll cover it again. So that's another thing. And also a short word about the medical plans. Medical plans definitely will cover scleral lenses in the right circumstances. So I encourage you to give us a call, 516-409-2020. If you have insurance, if you have keratoconus, and you want to see if it's something that is covered, we certainly can look that up for you and see. Cost should never be a reason to not seek care. Again, our website is www.keratoconusdoc.com. And we look forward to hearing you and taking questions, but definitely make good use of that medical insurance. It certainly can help. Have a great day.